Good evening. You're watching The Big Story with Haryanto Diman. I'm Olivia Kuei. Ahead on the show, we talk to the Dean of the Swee Hock School of Public Health on the rising number of unlinked cases in Singapore.
But first, at the Special ASEAN Summit on COVID-19 today, Prime Minister Lee Hsien Loong said the bloc has to mount a united response to the coronavirus pandemic as the region is deeply connected and interdependent. He stressed the importance of sharing information given that what works in one country may be relevant for another.
4 of the world's 10 busiest air routes are between ASEAN member states. And we also have the world's busiest land crossing, the causeway between Johor Bahru and Singapore. Therefore, none of us in ASEAN can be truly safe unless the entire region is safe. I would like to suggest 3 ways for ASEAN to respond together. Firstly, by sharing information, strategies, and experiences. We face a common enemy, so what works in one country may well be relevant in other countries. We should therefore keep one another updated on the situation in our own countries and cooperate with one another on issues which have to be handled together. For example, the repatriation of citizens from other countries back home.
PM Lee also said technology can be used to deal with the pandemic. He highlighted Singapore's efforts to use channels like WhatsApp to disseminate information, its work on the Trace Together app, as well as its use of technology to monitor compliance with quarantine orders.
PM Lee said trading routes and supply lines should remain open, especially for essential goods like food and medical supplies. This as none of the ASEAN states are completely self-sufficient. In addition, many countries in the region export goods and agricultural products overseas.
PM Lee also called for the adoption of clear guidelines across ASEAN to help the region take a balanced, rational approach that takes into account both health and economic considerations when dealing with such crisis.
It would be useful for ASEAN to have a set of common criteria or guidelines on when to impose travel or trade restrictions and when and how we can relax them and with what appropriate safeguards. We each have our own domestic considerations, but clear guidelines would help us take a balanced, rational approach that takes into account both health and economic considerations. The ASEAN Coordinating Council Working Group on Public Health Emergencies should study this issue.
Rounding up his speech, PM Lee noted that the crisis will fundamentally change globalization. He said leaders have the responsibility to rebuild domestic confidence in the value of cooperation and maintaining an open approach to partners both regionally and around the world.
We should put in place systems and guidelines to effectively handle future public health emergencies, because this won't be the last one. And we should also not lose sight of the work that is in progress. Therefore, I propose that ASEAN should still aim to sign the RCEP this year and should also continue pursuing the Comprehensive Air Transport Agreement with the European Union. Dealing with the immediate crisis while also not losing sight of longer-term objectives is the best way to enable our economies to survive this crisis and to bounce back after COVID-19 passes.
In other news, Singapore reported 386 new COVID-19 cases yesterday, our highest spike in a single day so far. We are approaching 3,000 cases with the current total at 2,918. The Health Ministry also confirmed yesterday that a 9th person has died from the virus, a 65-year-old Singaporean man.
4 new clusters were also identified yesterday, including 2 dormitories. Singapore's largest cluster, the S11 dormitory at Punggol, added 222 more cases. 586 cases have now been linked to that cluster.
Vanguard Healthcare's Woodlands Care Home at No. 2 Woodlands Rise is the second nursing home here to have a confirmed case. A 77-year-old male resident was confirmed to have the virus yesterday.
Meanwhile, the Singapore Police Force debunked claims that the police had stopped and fined motorists at roadblocks for not complying with the enhanced safe distancing measures. In a media statement, the police added that roadblocks are conducted to detect offences like drink driving and for other law enforcement purposes. But the spokesman said the police may take enforcement action if they come across motorists and passengers flouting safe distancing measures when conducting roadblocks.
Schools have been allowed to progressively resume the use of video conferencing platform Zoom for home-based learning with additional safeguards in place. The Education Ministry introduced 3 additional layers of defense, including an all-encompassing security button that consolidates the conferencing platform's security features.
And good news, today Singaporeans will start receiving their $600 payout under the Solidarity Package. Depending on their income, those eligible will receive an additional $300 or $600 in June. And many ATMs across Singapore will be covered with an antimicrobial coating as banks seek to assure Singaporeans that it's safe to withdraw from the machines. Now let's turn our attention to unlinked cases here in Singapore. According to the latest situation report by the Health Ministry, a total of 312 cases have been classified as unlinked. And to take this discussion further, we welcome back Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at the National University of Singapore. Good to see you again, Prof. So from March 30th until this past Sunday, 205 local cases were detected and they're still being investigated for links. What are the possible factors behind this alarming increase in unlinked cases, Prof?
So thank you for having me. There are 2 possible reasons that could explain the rise in the number of unlinked cases. The first is that there are genuinely more unlinked cases in the community, and clearly this will be worrying because it means that there are places out in the public where people are getting exposed and infected, but yet it is not possible to pinpoint the source, where these places are, or who are the people that could have spread the virus. That's the first reason. The second reason is actually more logistical. It takes a lot of effort to perform the contact tracing and to establish the links with existing cases. As there are more cases now, you can think of it as the database of known cases is actually growing, and every new case now has to match against this much larger database, and that takes time. Also, as there are more cases being reported every day, there is an upper limit to how many cases they can possibly work on for each day, even though the number of teams that are performing the contact tracing has increased. When the number of daily new cases is low, the contact tracing teams can perform a much deeper investigation and surveillance.
Prof, imported cases are dropping. Now, 0 have been reported since April 10th. All returning travellers have to serve their 14-day stay-home notice at government facilities now, and this has helped to cut off transmission from that source. Now, when it comes to local transmissions, linked and unlinked, what is key in bringing that figure down?
Well, there are now 2 fronts that Singapore is fighting this battle against COVID-19. The first is the community front, where the majority of the infections happen in homes, in public spaces, and in workplaces. The circuit breaker measures to close schools and workplaces, as well as to minimize movement out in the community, will significantly reduce this community transmission. Already, we can see that there are much less people on the streets and in public spaces now, and the level of human-to-human interactions has decreased tremendously. I'm actually optimistic that this front will start to show very encouraging results in the next 10 to 14 days, provided everyone cooperates and stay at home except absolutely necessary. So there is still a need for all of us to play our part to stay home, be mindful of personal hygiene, and to act responsibly. Practice safe distancing and preferably wear a mask when we really need to be outside. The second front is actually much more worrying, and I'm referring to the outbreak that we're seeing in the dormitories and construction sites, involving mostly the foreign migrant workers. I would actually label the situation in some of the worst affected dormitories as widespread transmission. and several of these dormitories house thousands of foreign workers. Measures have been put in place to segregate these workers into multiple locations, including floating hotels, army camps, unused HDB blocks, and I believe these measures will help. But over the next 1 to 2 weeks, I expect there will be increasing number of foreign workers that test positive for the coronavirus before we start to see the effects of these measures taken. So my estimate is that we will need at least another 3 to 4 weeks before we start to see the situation in the dormitories improve. But this does not mean that the measures taken are not effective. It just means that the situation involving the dormitories need more time because of the larger number of people involved.
Well, Prof, experts say that asymptomatic infections would also contribute to the rise in unlinked cases. One expert pointed to the studies done in the US, China, and Italy, which show that more than half to about 70% of those with COVID-19 are either asymptomatic or have minimal symptoms. But they can shed the virus for up to 4 weeks. Should this change how we've been battling the virus, all the safe distancing measures that we've been taking?
I don't think this knowledge of asymptomatic spread or virus shedding, the period of virus shedding, change what we have been saying all along, which comes back to safe distancing, practice personal hygiene, and now wear a mask when you're outside. It still boils down to how an infected person actually leave viruses on surfaces, coughs or sneezes openly and irresponsibly, and how we interact with one another, all of this that matters. Our social norms have changed quite a lot in the past 3 months. We have stopped shaking hands with one another. This helps to minimize contact and thus the spread. We adopted the practice of washing our hands very frequently with soap and water. This reduces the chance that if I touch any surface and end up transferring the virus from the surface to my hand and then to my face. We now stand preferably 1 to 2 meters apart from each other, and this again minimizes any aerosols particles when we speak to get onto each other. And now with the strong recommendation of mask wearing, we further reduce the chance that our droplets from talking, coughing, or sneezing contaminates any surface or any person nearby. So all of this will help. And I see that these are the same recommendations that governments worldwide have been giving to their people. So it's not going to change with this additional knowledge on asymptomatic transmission or viral shedding.
Prof, let's take a look at how we've done so far. Now, more than 200 composition fines of $300 each were issued yesterday to those who flouted elevated safe distancing measures. Plus, we just saw a national record of 386 new cases. How do you think the first week of the circuit breaker went?
Well, it takes time for people to get used to what is acceptable and what isn't. The first few days of the circuit breaker, enforcement officers have to remind people subsequently to warn people that what they're doing, such as gathering at void decks, having people from different households come together for sports or for food, those activities are not acceptable. There have been plenty of warnings given before we start to issue stricter penalties, such as the fines. But overall, I think you could say that clearly the human traffic has dropped tremendously. We see this in the roads, we see this in public spaces. The majority of people have listened to the call to stay home and to minimize interactions. We know this will have a positive impact to containing the outbreak in Singapore. And based on the numbers we are seeing for domestic transmission, if we exclude the foreign workers, there are actually very encouraging signs here. But it is important at this point to highlight we really cannot afford to be overconfident and to prematurely declare victory over the outbreak, even if we start to see only very few community cases near the end or after the circuit breaker. We must continue to remain vigilant. The situation can return and worsen, just as it did in the middle of March for us in Singapore.
Well, fantastic point, Professor. So, considering the rise in unlinked cases and what you've told us about asymptomatic cases, do you think the circuit breaker then should be in place beyond May the 4th?
Well, my personal take is that the domestic situation outside the dormitories will likely improve over the next 1 to 2 weeks. But the situation with our foreign workers will actually get worse, perhaps only improving 3-4 weeks later. Now, if that is indeed true, then it may be prudent to extend the circuit breaker perhaps by another 2 weeks until 18th of May, because the last thing we want is to prematurely relax the measures only for the local situation to worsen again. A 2 week extension may cause additional economic hardship for many people, but it will still be better than having to implement another 4 to 6 weeks of circuit breaker very soon after this current period. By carefully exploring the situation, perhaps guided by data and evidence from mathematical models, from knowing where the new cases are from in the last week just before the 4th of May, the government will be able to make a more informed decision whether the 4th of May is a realistic target, or perhaps we should choose to be prudent and opt for an extension.
Well, thank you very much for your time, Professor Teo. It's been a pleasure as always. We've been speaking to Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at NUS. And I believe the take-home message here is to stay at home unless absolutely necessary.
Moving overseas, US President Donald Trump declared that he has total authority to order states to relax social distancing and reopen their economies after rebuff from state governors. This comes after he announced plans to reopen the country ahead of schedule. He asserted that it was up to him and not governors to decide when to relax social distancing practices.
We will soon finalize new and very important guidelines to give governors the information they need to start safely opening their states.
But after that press conference, states including New York, New Jersey, Pennsylvania, California and Washington said that they will work together on their own timeline to reopen schools and businesses once the outbreak subsides. Across the Atlantic, the UK is set to extend its lockdown until at least May 7th. The death toll in the country continues to climb past 11,000. Elsewhere in Europe, Spain, which has the second highest number of infections, has begun to ease lockdown restrictions. This as they saw the smallest proportional daily increase in the number of deaths and new cases, with signs indicating that the situation was taking a tentative turn for the better. Some businesses, including construction and manufacturing, were allowed to reopen. In China, early-stage human tests for 2 experimental vaccines have been approved. State media reported that they are being developed by a Beijing-based unit of Sinovac Biotech and by the Wuhan Institute of Biological Products. Meanwhile, Russia has become China's largest source of imported cases, with 409 infections originating in the country. China today reported more than 82,000 cases in total and around 3,300 deaths. There were 0 deaths in the past 24 hours. Now let's focus on the former epicenter of Wuhan with our China correspondent Elizabeth Law, who's on the ground there. Hi Liz. Now Liz, wet markets in China have come under increased scrutiny recently after Wuhan's Huanan seafood wholesale market turned out to be a focal point for early viral infections. There's also pressure from the US to call for the complete shutdown of these wet markets. How would this affect China's food security sector?
Hi Jan, hi Olivia. Firstly, a bit on the background. So I'm standing here by the banks of the Yangtze River, one of 2 main rivers that runs through Wuhan. And as you can see, people are out and about already. There are people behind me in this park. So life is gradually starting to get back to normal. Now, to answer your question about the Huanan, beg your pardon, about wholesale markets and wet markets in China, these markets are necessary because most of them ensure food security for major cities. Food produce from all over China and all over the world, in fact, come to these wholesale centers, which then supply the shops, be it supermarkets or small neighborhood shops in cities across China. So it's very important, especially for urban folk, to have that there are these sort of wholesale centers. I have spoke to academics who estimate that about 80% of Chinese people buy their produce that originate at these wholesale centers. The other 20%, they buy them directly from the producers on platforms like Taobao and JD.com.
Right, Liz. You've just described a little bit about, the people milling about in the area that you're at. But it's been about a week since Wuhan reopened its major transport links after the 2-month lockdown. So, what's the traffic and transport network situation like in the city? And has the movement of people within and out of the city picked up in the past week?
Mm. So gradually, traffic in the early days after the lockdown was lifted, traffic really was still quite sparse on the roads. There's a lot of space. Very few cars were out and about. Of course, it's more than during the lockdown, which was completely no cars at all, except for ambulances and essential vehicles that were delivering medical supplies or groceries to people. But as the days have gone by, we have seen more and more flights getting added, even though some of them have been cancelled because of a lack of demand. But they are trying to bump up the number of flights going out of the city. There are more trains that are leaving Wuhan as well. But the only problem is that when it comes to places like, especially Beijing, which is the capital city, which has very tight control measures, only 1,000 passengers, commuters, I beg your pardon, are allowed to leave on trains to Wuhan, and you get your ticket for those trains through a ballot.
Well, Liz, we were speaking behind the scenes earlier, and we understand that you had to undergo the COVID-19 swab test earlier. What was the experience like?
So as part of the requirements for me to go back to Beijing, I have to do 2 COVID tests. One here before I leave Wuhan, and one in Beijing before I'm allowed to re-enter my estate. So the one here, there were 2 ways that I could do it. First, so the one that I did was I had a throat swab taken. Basically, you just lean really far back and say as though you're going to the dentist, but they put a swab all the way down your throat, and it feels like someone is pushing something down your throat and pressing around it and sort of like prodding at it. It makes you want to cough and vomit at the same time. Just when you feel you're about to throw up, it's over. But what that leads to is a massive coughing fit when you're done, which obviously horrifies all the other people who are in the hospital. Then I was told that there's another method, a much easier method, which all I had to do was to spit into a cup. But yeah, I found that out quite late.
Well, thank you so much and stay safe. And of course, bringing us around Wuhan as well, that was our China correspondent, Elizabeth Law, joining us live from Wuhan.
Now, before we go, the Land Transport Authority has just announced that it will adjust the operations of bus and train services this week with effect from tomorrow, April 15th for buses and Friday for trains. LTA said daily bus and rail ridership has fallen by more than 71% and 75% respectively.
Selected bus services serving the CBD or recreational places will be suspended. Train frequencies on north-south, east-west, northeast, circle and downtown lines will be reduced to no more than 5 minutes during peak periods and around 10 minutes during off-peak periods.
In addition, operating hours for these lines will end around 30 minutes earlier. Now, for more stories, do visit straitstimes.com. Those are our top stories for today. Once again, I'm Haryanto Diman with Olivia Quay. Join us tomorrow for more stories on The Big Story.